Wait, my grandpa's depressed? Really? No way.
I get a phone call from a nurse saying, hey, I just overheard someone say they want to blow their head off.
Ooh.
There has been a rise in suicide attempts
within
seniors. Yeah, because they think about it, they have some access.
Wow.
What do they have? They have medications, right? They have medications. Wow. They have time to sit and think about how they're going to end their life. Mm-hmm. And they do attempt it.
Wow.
Mm-hmm. Yep.
I would never think about seniors and suicide.
Yep. It's a thing, unfortunately. Yeah.
Unfortunately, with the rise of COVID-19 and how it really isolated seniors, it was terrible. And what we saw in these last several years is that seniors didn't really have the ability to connect. In this episode of Charlene Care Pods, we have a special guest, Tegjula, with IHearU Mental Health. She is going to walk through senior care when it comes to counseling, depression, mental health. She's an expert in the field, and stay tuned. This is a great episode for you and your family to listen to. Tegjula, how's your day going?
Hey,
how's
it's going great. How about yourself?
Not too bad. I'm glad to have you on the show.
Yes.
I was talking a little bit about what you do. And
absolutely.
So if you don't mind, just tell us about yourself in general.
Sure.
And what got you into doing what you do.
Wonderful. Well, thank you again for having me. Well, my background is in senior living. Okay. And way back when I was in graduate school, I have my master's degree in healthcare administration. Nice. I gravitated toward senior living. I went on an internship and I just fell in love with working with seniors. And in my cohort, I was the only one who went into senior living. Everyone went into hospital administration or other aspects of senior living. And so after my internship in Dallas, I had my first role as a manager at a senior living facility in Plano. Stayed there for a while, and then I moved on to be an executive director. So from there, I was an executive director for a few companies for a number of years. My last role in senior living, I was a director of operations for a senior living corporation. And then we were blessed with a baby boy. And one night I got a phone call around 10 o'clock saying, hey, Tegjula, we have a missing resident. I'm like, okay, well, you need to find him. Find the resident. They couldn't find him. My husband was not at home. My mom did not answer the phone. My sister did not answer the phone. So I'm like, okay, this is me and my 4 or 5 month old baby boy. Had to pack him up in the car, drive from Mansfield to Frisco. And I just knew, I probably need to take a step back at that time. It was hard. As much as I loved being in senior living, I need to focus on my family, right? So after that, I worked in a nonprofit for a little while, and then COVID hit.
Yeah, everybody.
And when it hit, it hit. So I ended up resigning from my job so I could stay home with my son because the daycare closed twice. It was just a lot going on, right? But I was blessed to be able to be home with him and spend that quality time with him, teaching him. But as I'm with him, I'm realizing that I felt like I was a better mother if I was working. Right. So just having that balance. Even though I love being with him, but I'm home one day watching TV and I saw a news clip of this 16-year-old kid in Houston. How he started a laboratory testing for COVID. And I looked to my husband, I'm like, oh, if he can do it, surely I can do that, right? Because I needed to stay busy. I needed to do something, right? So anyways, my husband and I talked about it, prayed about it, and we started a lab.
Wow.
And so we consulted with a company and they helped us, jumpstart everything. And we started a lab. We tested for COVID.
Nice.
And we helped out the community because at that time, as you can think back, those tests were a ridiculous amount of money. Everyone did not have access to it. It was, it was just, you can find them as well. And so we were very strategic in where we found a location that everyone could access.
Wow.
We want it to be where underprivileged population could not, so they could easily get to it. However, once the word got out, we were helping anybody and everyone, And so I'm glad that we did have that opportunity to serve the community.
Wow.
And so we closed the lab back in December December of 2023.
2023, last year.
That doesn't sound right.
No, okay.
2022.
2022?
Yeah.
Yeah, so.
So I'm thinking, I still need something to do. What am I going to do? I mean, I'm really in one of those accidental entrepreneurs, right?
Yeah.
And so there is a company out of Florida called Mindful Mental Health Services that I connected with, and they provide cognitive behavioral therapy services to seniors, and they were looking for a partner to help them expand. And I raised my hand.
That was it?
Yeah, that was it. That was it. And so my company is IHearU Mental Health.
Okay.
And what we do is provide mental health therapy services to senior citizens. So we help them cope as they're dealing with depression, anxiety, transition, mood disorders, anger management, family issues.
Everything.
Anything and everything. Just life. So we help them cope through life. And we do this through our clinicians that we hire. Okay. They're licensed clinical social workers, licensed professional counselors, clinical psychologists, and also marriage and family therapists.
Wow.
Yes, and so our clinicians go into the home, they go to wherever seniors are to provide them with therapy services. And so, looking back, when I was working in senior living, there really weren't services like this that were readily available for seniors. Actually, I don't think that there were any. I didn't hear of any when I was in those leadership roles. But so we are blessed to be able to care for these seniors. And I have a great team of clinicians. Right now it's about 13.
Nice.
They're in Denton County all the way down to Tarrant County, spaces in between. And, I'm looking for more great people to join us so that we can share our services with the community.
That's amazing. That's like, I feel like, number one, like the need is like so prevalent. And the fact that, like you said, like you have the background for seniors and then you stumbled upon this through this. And it's pretty cool. Yeah. That's pretty cool. What, when you're looking at, if say for instance, someone is considering something like this for their loved one, how does that process even start? What does that look like?
It's such an easy process. One of the things, we want to make this as smooth and simple for anyone involved because dealing with life issues is tough.
Yeah.
Sharing that with someone, that's very difficult as well. So once someone does find out about us, all we need is a front and back copy of the insurance card, a reason for the referral, and we're able to process their referral within a day or so, and then the clinician can go out within a week.
Wow. Does it have to be a doctor that's ordering it? Or
no doctor's order is needed. That's the great thing about it. No doctor's orders, because this is talk therapy. So the same way anyone will go online to one of those telehealth companies, that's what we do. So you don't need a doctor's order because we're not prescribing medication.
Wow. And so how does that work from, say, for instance, I'm needing something for my grandfather or something, right? So what out-of-pocket expenses there? How does that work for authorizations? For, insurance is one day it's this, one day it's that. How does that work for the family?
So I can say right now, the only insurance that we have been getting pushback on is Medicare Advantage HMO. The PPOs, you're able to take that, yes. And Medicaid.
Okay.
Outside of that, we take everything else. Yes. Now we do have some patients or some clients that, even though they don't qualify, their family still wants to pay out of pocket. And so we will go ahead and accept out of pocket, and we'll make it so it can be easy for them. So instead of seeing them once a week, we can do maybe every other week and set up some type of payment plan for them as well. But we are accepted by most insurances.
So
Medicare.
So let's say for instance someone has a loved one who has dementia, it's early stages.
Yes.
What does it look like for a plan of care for your team to come in and like take care of them?
Yes. So what I tell family members and communities is that we will never deny someone. However, we want to make sure that it's beneficial. Okay. So we'll do an initial assessment. However, if we don't feel that they would benefit or be a good fit for our services, then, you know, we won't be able to care for them.
Gotcha.
Those that are in early stage dementia, they can still benefit from our services. Even if our therapist sits with them for 30 minutes, they can leave them with some tools or just be able to help them. They may forget it in the next 2 or 3 hours.
Right.
But the tools that we are able to share with them is beneficial for them and their family members as well. One of the things that we do, our services also covers for family therapy as well. So as long as the senior is covered, then the family can come in and also receive services. Because oftentimes the family members are triggered. They are the trigger.
They are.
Right? They are the trigger.
Very true.
Yes. Or, you know, the family is having a hard time with the transition as well. And so we do help with that. So like today, I got a referral yesterday with someone with dementia. And over the phone, it sounded like, ooh, this is not going to be a good fit for us. However, again, I don't want to just flat out deny. And again, I am not the clinician. So I'm the owner of the company. So I leave my, our clinicians are able to make those decisions. However, I just wanted to lay eyes on that resident. And so I went to the community and I talked to the executive director and the nurse, and I laid eyes on this resident. And I could just tell that he would not benefit from my services. His dementia was so much further along than some of the others there. However, we're able to help his family, help his wife, as she's dealing with, so she lives probably about 5 or 10 minutes away from the community, but we will be able to provide her with therapy services, because it's hard, you know, when you've married to someone for 50, 60 years and taking care of them for so long, and you can't, it's a lot.
Wow. I think it's beautiful because, you know, like, it's very easy for families to feel alone, right, in those transitions, those life transitions. So when, you know, a loved one's going from independent and then all of a sudden in a span of 2 years, fully dependent. It's
or
like
less, 2 years less. I mean,
and grieving that. And I think that's, wow. So, you know, so let's say specifically someone gets onto your services. What does that process look like from a treatment plan, like a frequency from the clinicians that go out to do the assessment? What does that look like?
So for the initial assessment, it's called a biopsychosocial assessment. And so that's usually about an hour where the clinician is just getting all the information that they can regarding this resident. And they also, after the assessment, they'll meet with the staff and talk to the family members as well, just to help guide them through their therapy sessions. So after the assessment, as far as the plan is concerned, it just depends on the client. And so they'll either meet them once a week, once every other week, anywhere from 30 minutes to an hour. We have had clients on our services that started with us, then they're fine after 3 or 4 months, and then life happens again. And so we'll start them back over on our services. And so we're always there for our clients when they need us. So we have had family members, I want my mom, my dad on services, and the clients, they turn us away.
Oh, wow.
If you can imagine, seniors really aren't, or that this generation aren't, they're not used to just sharing. They're not used to going through therapy. They're from the generation where they pull themselves up by their own bootstraps. They don't share, you know? So there's some family members that we have had to have those difficult conversations. Sorry, your mom turned us away, and that's their right to do so.
It's true.
We've had to have the conversations because sometimes families want to know, well, what happened during therapy? We can't share that information. We have had clients that, I had this one client, he was actually our first in-home client, because we go to the homes of the clients. And so I always like to meet them first because I want to make sure that our clinicians will be comfortable in their homes. So I went to meet him and we were just chit-chatting. He was like, is this going to be confidential when I meet with a therapist? I said, yes, sir, it is. He said, okay. So he changed the subject, asked me again, Tegjula, are you sure this is going to be confidential? I said, yes, sir. Is everything okay? He said, I have some stuff that I've been holding on to. I didn't think I was going to live this long. And I need to get some stuff off my chest. So our therapist has been working with him for many months now, just helping him deal with issues from his past. Our therapists who are marriage and family therapists, when they are talking to couples, we found out that these couples, they've been together maybe 40 years and still dealing with stuff that happened 30 years ago. Year 1, year 2, year 3. Yes. Ooh, that's a lot. Hard. That's a lot. They've been carrying that. Wow. So we're helping them walk through that process. We're helping to enhance their lives for as long as they have left on this earth. Man, that's a really big deal, especially, can you imagine being married for 40 years and there's just layers, it's like an onion that hasn't been like peeled in like literally 20 years. Like, you remember that one time when you didn't help me change a diaper? That's how it is. And it's stuck there for 40 years. Yep. Wow. And it comes out in different ways. It does. It comes out whether through a disease or unforgiveness and bitterness. And, wow. And we have, I'm just thinking, this one couple, the husband is in assisted living. Oh, the wife is as well, but she's in a different one, but she has dementia. So he's trying to seek forgiveness, but cannot get it because she has dementia. She doesn't even remember him, and so we're just helping him just cope. Yeah, you guys are doing a great service. Like, that's a really that's a big deal. Like, because I don't think a lot of people understand that, like, especially, I think it's in this day and age, like the microwave generation, right? Like, everything is like quick change, like new, but like the reality of it is that there's things that are constantly that we go through that we need to like process. It takes a long time. Yes. It can't be like a quick fix. And so it seems like you guys are doing a great work in that. And one of the other questions I was thinking is like, so say for instance, someone starts, is there like a max, or is it like is there an authorization limit to how many like visits can be done? It's whatever is medically necessary. Wow. So that is what we have been told. So whatever is medically necessary. So as long as they, because sometimes when you're, I don't want to say digging away, but when you are trying to get down to the root, it's going to take some time. Yeah, it is. Yeah. Because if you can think about it, first of all, you have this stranger coming to your home. Like, who are you coming to talk to me? Yeah. But then just gaining that trust so that they can open up, and just that comfort level where they can just be open and honest and actually work towards goals. So our therapist gives them goals. I mean, therapy is just not a one-way thing. Yeah. I mean, it's only as good as exactly. There's communication involved. Sometimes there's work. There's work on both sides. And so as long as the seniors are, they want to participate and they want to do the work. Like, for instance, one of my clinicians asked someone, he was a former pastor, and he's just having a hard time right now. And so the clinician asked him, okay, well, for our next visit, I want you to write me a letter and talk about one of your best sermons and how it made you feel. So that's just different tools like that. That's pretty cool. Make them reflect and like think about it, bring those memories back. Exactly. That's pretty cool. Yeah. Wow. Do you all ever have the opportunity to, like, say for instance, there is a client or a patient you're taking care of and the loved ones are out of state? Are they able to do some type of like group Teams calls? Absolutely. How does that work? So it's telemental health. Cool. So it's telehealth. Okay. So we do offer telehealth services that can either be on video or on the phone. Our seniors get a little confused with the Zoom and the Teams, and so most of those are over the phone. So we'll set up a conference call for the family members. So yes, that is available and that has happened.
That's cool. Have you ever done it to where maybe the clinician's there with the client and then a Zoom call's done there if they can't help? Okay.
Yes,
that's
yes,
pretty cool
we have
too.
done that.
Wow.
Yeah. But most of our interactions are face to face. The seniors, they appreciate that. They like that more.
Well, can you share like a memorable success story?
Sure. So there was one client who came on services with us. He was home and he had to make the decision to move his wife into assisted living. Actually, no, she moved into a nursing home. And he was also home taking care of their adult daughter who had bipolar and schizophrenia. She was in her 30s. And so while mom had been the primary caregiver for her entire life, now he's in this situation. And it was really sad for him. He was very depressed, did not feel comfortable leaving the house to go out with his friends anymore. He did a weekly breakfast at McDonald's with some of his friends, and but he stopped doing that because he felt that he just had to be there for their daughter. He was depressed, and so we were referred to him through a home care agency. And once we started visiting with him, he just expressed a lot to our therapist, and our therapist, the goal for him was to get him back out the house to go have his breakfast with his friends. It started off with him walking the dog, getting out the house doing that. And then he would take those baby steps, but before he even before he went back to having breakfast with his friends, he went out and he met our clinician for a session. And they actually had breakfast and had coffee. So that was one of the sessions. And I thought that was amazing that she came up with that idea to do that. And so they did that maybe 2 times. And then his homework was, okay, pick up the phone and make that call and go out by yourself with your friends. And he did that. Yeah, so that was one of the success stories that stood out. I mean, we're still helping him cope as he's dealing with, the depression with his wife no longer being in the house, and still helping and supporting his adult daughter. But that was something that really stands out for me as far as a success story.
It's amazing.
Wow.
Yeah.
I think it's amazing because, like, I feel like that right there is probably one out of millions of situations and circumstances that people go through. And I don't think they realize that service is out there.
They don't. And so, being a small business owner, I am not just the owner and the accountant, HR, I'm the marketer as well. And so, I have some mornings where I'm waking up like, oh my gosh, I really need to be in Plano today, but I also really need to be in Midlothian.
Yes.
How am I going to do that? And so I'm all over the place.
Yeah.
There's
so many people that need it.
There is, just educating people on our services and what we do, because there aren't a lot of companies that do what I do. And, I have to sit down and really explain, okay, this is why seniors need this. This is why your residents need it. And, oftentimes I'm going back to the same place 2 and 3 times until someone will, until they tell me no. Until they tell me no. Wow. So that's what I'm doing. I do a lot of education. We have a program called Thrive. So Thrive by IHearU, and what that is when we go out into the community or go have lunch and learns. I have a brunch and learn coming up here one Sunday afternoon. So I'll be meeting at a community with family members, just sharing our services so that people know that there are resources out there to help you and your loved one get through life.
That's cool.
So,
wow.
So yeah.
It's amazing. What are some of the things that are when you're encountering either a family or a facility, what are some of the reasons why people are hesitant, or what would you say, like in your experience, you know, maybe the myths,
Right.
or the like, ooh, I'm not sure if I really want to do this.
Yes.
It's just
Well,
a shrink
oh gosh.
or something. Like,
Exactly. Well, I can tell you there was one nurse who I met, and she told me, "Oh, all my residents are happy."
yeah, oh yeah.
Girl, no, they're not.
They're all just like kumbaya. And
Yes,
everybody.
they're not happy. So I think just the word therapy. I mean, it's still, people
It's still,
yeah, people
that
really
word
don't
taboo?
embrace
Is that
it.
a
It's
taboo?
taboo.
Yeah.
Not only that, I hear you mental health. When I hear mental health, people still think, oh,
Something's wrong with you.
yeah. I had one community that we were in, and we were asked not to wear our name badges when we come in because we don't want to, offend the residents or make them embarrassed. However, when my clinician kept going in, and they were like, "Oh, who are you talking to?" And they found out it was a therapist. Oh, well, I want to talk to someone. So I guess people, I mean, we still get pushback. Because people just don't think that it's really needed. Oh, well, we give them their medications. They participate in activities. They eat. We give them baths. The mental health aspect is not being addressed for seniors. They get sad. They get lonely. They get depressed. They're dealing with stuff from their past. They're upset that, their loved one has moved them into an assisted living community. I mean, I've never met a senior that is just excited, hey, moving into an assisted living community. That doesn't happen.
You're mourning so much.
It's loss.
Like the loss of a lot. Freedom. The home with memories.
Exactly.
That does something to your soul.
It does. Absolutely.
And that's a really good point. It's like when you're transitioning into that new situation or that new experience, it's like not everyone that's around you is not trained, right? To be able to walk you through those things. And that's really good.
Yes.
Do you all offer like cognitive behavior therapy for specifically for seniors as well? Like, is it like a care path?
That's exactly what it is. Cognitive behavioral therapy.
Wow.
Yes.
Can you break that down to what that is
so
for?
CBT.
Yep.
So it's basically your thoughts control your actions control your behaviors, behaviors control thought. I mean, it's just a it's a cycle. So if you're thinking positive, then you will have positive behaviors. Those behaviors will turn into positive actions. So yes, it's just a secular process.
Yeah. Wow. Do you feel like when in y'all's experience when you are with seniors, is it hard for them to understand that kind of like concept?
It is. No, it is. But we don't go into the the specific.
Keep it simple.
Keep it simple.
Nice.
Yes. I mean, we have to keep it simple for everyone again, because this is a newer, it's not really a new concept, but as it's being presented in a way that, people can understand. I mean, a lot of people don't think about it.
Yes.
They don't think about that it is needed. But I am a true believer that everybody needs therapy.
Yeah.
At some point in their life.
Everybody
needs it, because life will continue to life.
Yeah.
Things will continue to happen. It doesn't stop. It doesn't stop.
Yeah.
So, I mean, I'm a firm believer in...
Yeah, it's kind of like you're driving a car and you're like, I'm never going to get an oil change.
Yeah.
Unless you're a Tesla, I guess.
Right.
But Teslas, I mean, you still have to do you still have to charge it.
You have to charge a car, yeah. Yeah.
Like it's, how much more different are we? We have to have someone to talk to. We have to walk through life's issues. Question.
Yes.
Talk therapy. What is that? Is that...
It's like really what you and I are doing right now. We're talking.
Yeah.
So the therapist is asking questions, helping you through your thought process, helping you to think differently, process differently.
And so walking through those, and is that something that that seniors, they kind of like, maybe they feel like they can use that term maybe easier than like mental health, or is that different? Are there two different things?
Counseling. So we say that, we
Okay.
provide counseling services.
Okay. So if like a facility is interested in your services, can they use like counseling services, talk therapy?
They can,
Okay,
yes. And we do use those words interchangeably.
Okay, cool. Nice.
Yeah.
Nice. I asked a whole bunch of questions.
Come on, bring it.
So when, say for instance, you are going to talk to a facility or assisted living facilities as a whole, just assisted living facility,
Yes.
and you're talking to me, and I'm the ED.
Okay.
And what would you say to me that would help me understand why your services are actually needed for the morale of the actual facility?
Absolutely. I actually had a talk with an ED today.
Okay, cool.
So
I'll be the
yes,
ED.
you'll be the ED.
All right, let me
Charles,
get my coffee in.
Yes.
All right. Okay. All right, I'm ready.
Make sure the state is in here,
Yes,
right?
ma'am. Yeah.
Okay. So one thing about our services, not only is it beneficial for our residents and their family members, they're also beneficial for you and your staff. Your staff is busy. They don't have 10 minutes or up to an hour to sit down and talk with the residents. They're not trained to deal with just any type of mental health aspects that come along with what they're going through. And so that's why we're here. We're here to help them. We're here to help support your team as they're giving care throughout their day. So that's what
how much we have to pay you? How much?
There are no out-of-pocket costs. This is covered under insurance. So it's covered under Medicare and private insurance. Now, if there is a copay, then they would have to pay that. But most seniors don't have that with Medicare.
Wow.
Yeah.
So we don't have to pay anything? What about the families? Do they have to pay any copays or anything like that?
No, they don't. That's why we're here.
Maybe I'll think about it. That sounds pretty good. No, that's really neat though.
Yeah, that's why. And when people say there's no copay, there's no, you don't have to pay out of pocket. Copays nowadays anywhere from $10 to $40 or zero.
Yeah.
$0, right?
Wow.
So yeah.
So I just moved from California.
Okay.
I tell you, Tegjula, my son brought me all the way here from California, and I do not like this place. And all my buddies, my cigar buddies, they're all back home in California, and I can't smoke with them. I can't watch the game with them. I've got people here in wheelchairs and walkers all over the place, and I don't use them. I don't know. It's depressing.
So from what I hear you saying, you're having a hard time with this transition. This has been hard. Yeah. Because you were in California for many years.
And I can't go. They won't even let me smoke my cigar outside.
Oh, wow.
I got Cubans.
Oh.
I can't
Those are good from what I hear.
Yeah, I can't smoke. What am I supposed to do?
Wow. So your daughter moved you here. Okay. Are you and your daughter on good talking terms now?
Well, she's my only one I got. So I ain't got no.
Yeah.
That's my baby girl. Yeah.
Well, that's why we're here. I'm so sorry. I know that's very hard, but we have a great clinician that I would love for you to meet.
Okay.
Whenever you're ready. So he can be here. He can come and visit with you. We would love to talk to you about what you did in the past when you were in California, and maybe we can implement some of those activities here. And maybe we can even talk to you, the ED, about taking a smoke break.
Hey.
And I can go on one with you if that's okay.
Oh, come on now. That sounds great.
Yeah.
So you all can help me with that and get me kind of navigate that?
Absolutely. Yeah.
Is there how long are those talks?
However long you want them to be.
Okay.
It can be up to an hour, but it can be less than that. And we can come once a week. We can come every other week.
Can they come and watch Thursday night football with me sometime?
We can come and watch football with you. We can go to the happy hour with you.
Really?
We may not be able to drink.
Oh.
But we're just going to hang out with you.
Okay.
Yeah.
I would like that.
Yeah, we would love to be here to support you.
That's a good one. I like that. That was a good one. I think that would be, I feel like, I didn't even know that you could do that in terms of like walk them through that process too.
Oh yeah, absolutely. So
cool.
it's kind of like when someone moves into a new community, you have the marketers, they do the discovery process. We do a discovery process as well because we want to get to know about them. So the information that I gather from the staff, that I gather from the family members, I pass that all off to the clinician. So when I have someone to say, yeah, I'm trying to make my wife's favorite lasagna recipe, but I just can't get it right.
Wow.
And she can't tell me anymore because I know she has dementia, but she knows this food doesn't taste the same because she's Italian.
Wow.
And it's not, I'm not Italian. Guess what? I have an Italian clinician.
Wow.
And when I tell you, she actually goes to this home to see this client, how they have just connected.
That's cool.
And they can talk about recipes and share recipes. Now, do we always have that connection? We don't.
Right.
But we try to find, so we find those connections. So that's very important for me when we are getting on new clients. What can that connection be?
And the intentionality to find that connection is
exactly.
Wow.
So that's really important for me.
That's really
and it's exciting when we are able to find that.
And to help them heal, right, through the whole process of those transitions or the grief or the sometimes I'm sure you uncover things, your team uncovers things with with your patients,
right,
that they may haven't realized it was there.
Yep.
Because of those layers, and that's really cool. That's
absolutely,
cool. What questions, you guys? I know Tina's always good with the questions.
I did have. I don't know if I missed you talking about it, but why did you? So I know you stopped the COVID lab. Why did you decide to go into senior mental health?
Because I could not get away from my passion with working with seniors. I thought I was done with it, and I said, "Oh, I'll never go back to senior living." But there's seniors are always there. They're always going to need the care, and I'm about finding solutions. So the same way that I found a solution by starting a laboratory to meet the needs of the community, I've thought and prayed about it and found a solution to meet the needs for seniors. So yeah.
Was that what originally also got you into senior care? Or was there like a specific moment you remember?
Oh, that's a great question. Was there a specific moment?
Or experience or anything?
I think it goes back to my my time when I was in graduate school. Actually, let's take that back. Before I even started college, my sister actually, her undergraduate degree was in healthcare administration. And she was home for a summer doing her internship, and she did it at a nursing home. And I went up there a few times with her, and I remember, gosh, I haven't thought about this in a while.
Wow.
I actually helped to feed some of the residents during lunch, and I was in the office with her. She was talking to the administrator, and I remember stories about how they both had to deal with HR issues, and I'm like, oh, this is pretty cool.
And before you went into healthcare?
I was in high school.
Wow.
I was in high school then, and so I can say then I knew that I wanted to follow in my sister's footsteps and major in healthcare administration. So I did that when I was in undergraduate school, even though that when she graduated, she did not go into the healthcare industry. It's something that I knew that I wanted to continue on with. So when I graduated from undergraduate school, I went to Florida Agricultural and Mechanical University in Tallahassee, Florida.
Tallahassee.
Go Rattlers.
Hey.
I went into the insurance industry, and I worked there for a year, but I'm like, this is not what I went to school for. I lived in Virginia at the time. I'm like, I want to go to grad school. And so my sister lived in Arlington, Texas. And so I traveled here. I applied for grad school and moved here, and I worked, and I went to grad school full time. I worked full time, went to grad school full time.
Wow.
That was crazy. I would never do that again. Wow. I guess maybe because I was younger then, but I'm thinking about, was I really in class till like 9 o'clock at night, 9 o'clock, and then went to work the next day? I did that for 2 years straight.
You did that.
But I did that. But thank you. But no, it's a great experience, and it's just something I've I've stuck with, and I've grown with that, and I love it. I love being able to care for seniors. Nice. We're all going to be there one day, y'all.
Yes.
Every day.
It's true. And it's true. I feel like we talk about this all the time. It's like the population is only going to increase.
Absolutely.
And I think it's so important for us to make sure that everyone is aware of resources, avenues, point our seniors in the right direction. What resources can they have? What resources can their loved ones have?
Yeah.
So that everyone can help. It takes a village,
It does.
Yeah, that's really good.
Absolutely. Yeah.
Yeah, speaking about growth, how have you evolved, like since when you first started in this industry and now?
Oh gosh.
That's a good question.
I tell you, being a business owner, you're learning every day. Just learning from other entrepreneurs that aren't even in the healthcare industry, just sharing stories about growth and what does not work, what does work. This is not a role that is for the faint at heart.
That's true.
One thing I've learned, one thing that I deal with, it's hard to cut it off. Like at night, it's hard. Like I can be in bed, I'm like, oh, this is a great idea. Let me get out and work on my computer. But I'm learning how to shut it off, right? And so that's one way that I have evolved, because I have family at home. I'm a wife, I'm a mom, I'm a foster mom. I have to make sure that they're taken care of. And so, every day is an adventure. It's what you make of it. And so as a business owner, I don't have the luxury of I guess I could. I can make a decision one day and just be at home, turn on the TV, not make any calls, not do any follow-ups, but I'm not able to grow that way. No one will know about our services that way, I'm not able to bring more people on our team. So, I want to be able to grow, to bring more people on. So every day it's a grind. It is, but I'm having fun with it. Every day is not fun.
That's true.
But I have to make it fun. I have to make it exciting. So I look for those ways. So when I get those wins, when I'm able to schedule those meetings and someone is actually taking time to listen and share our service and say, you know what? Oh, I have one person for you. I have some folks for you. Let me tell you, my first community was out in McKinney. And the nurse, when I met with her, I'm thinking, she is never going to refer to us. She's really tough. She's a wonderful nurse. But she told me, Tegjula, I don't know you. I've never heard of services like this for you, but it's needed. So I'm going to give you one resident and we'll see how it goes. Since that time, we've had to have up to 3 clinicians in that community because of the growth that we've had there, because she trusts us. Not only does she trust us, she can see the benefit of our services in her community. So there's one resident, she would always push on her button because she wanted someone to come in to see about her. She wanted the attention.
Lonely.
Yeah, she was lonely. But after a few months, she's not on that button as much anymore. Just simple things like that. She was
trying to talk to them and having that longer period.
Exactly. And so every day there's growth. Every single day, there are challenges every single day, but you just have to keep pushing, because I know that our services are great. I know that they are needed. I know that they're life-changing. And so that's what keeps me motivated, keeps me going every day. Yeah.
That's cool. That's awesome.
I suddenly have like 3 questions.
Sure, go ahead. Yeah.
Okay, first one, what are some common signs of mental health struggles that are often overlooked with seniors?
Seniors that have suicidal ideation. That is
really the subtleties but it's not subtle at the same time.
Yeah, and I get those phone calls. They're like, we need someone right away. When I hear someone say that, I get a phone call from a nurse saying, hey, I just overheard someone say they want to blow their head off.
Ooh.
I mean, did they have a gun? No, but they have suicide. They have those thoughts.
Yeah.
You know, when there's someone that just, they had to pull into the community because she ran out in the middle of the street, wanted to get hit by a car.
Ooh.
Those things happen. And I think, not that I think, but I know what's important is just the education piece for the staff, for everyone to be on the lookout. Like, just because that it happens, not just I would say the thoughts happen. They're there. They're signs. You just have to look out for that. So that's one of the things that I think people don't think that seniors would really do, but and I wish I had those statistics. I have them somewhere. I do have them. But there are statistics that there has been a rise in suicide attempts within seniors. Yeah, that's because they think about it. They have some access. Wow. What do they have? They have medications, right? They have medications. Wow. They have time to sit and think about how they're going to in their life. Mm-hmm. And they do attempt it.
Wow.
Mm-hmm. Yep.
I would never think about seniors and suicide.
Yep. It's a thing, unfortunately. Yeah.
I would never think of that.
Mm-hmm.
Wow.
Yep.
Whew. Go ahead, keep going. That's a good question.
This one, I don't know how it works, but if there is a situation where like a therapist would need to like pull in, like say there's like some bad family dynamics, how does it work pulling in like a daughter or a son? Like, does that happen a lot? Or is
it does. Oh no, it does. It does. Again, those family members can be the trigger. And there are some issues that have gone unresolved for many years. I offered family therapy just a few weeks ago for a son and his mother, and he declined. He's like, no, I don't need it. But clearly, sir, on this little 10-minute phone call that I've had with you, I can tell, and I am not the therapist, but I can tell there are some unresolved issues there. And he did admit that there are some unresolved issues, but he is not at a point where he's ready to handle that. And that's okay that he has made that decision. It's not okay, but it is okay. That first of all, he does recognize that there is an issue between he and his mother. He thinks his mom is manipulative, that she makes up stuff. He said it's been like that for years since he was a young child. And so, there are issues there, but you just have to walk with them. That's what we do. We're walking with them step by step with the senior and also their family member. And so in a few months, I'm going to follow back up with them, say, hey, your mom's doing great on services. What do you think about joining one day? He still may decline, but we're here for the whole family.
Do you guys offer or like refer if like the daughter's like, I want to see a therapist and talk about them, or do you guys refer them out to someone else?
So we can do therapy for the family member and the resident together, and also separate as well. Wow. Yes, so we can offer it just for that
as long as they're still a client, yeah.
As long as they're still a client, yes.
Wow.
Yep. Yeah.
Third one.
No, go ahead, yeah.
This is kind of like a full wrap-up kind of thing, but what advice would you give to like families of those taking care of their parents or someone who are struggling with like mental health issues?
Yes, that's a great question. To seek help. And don't be afraid to ask for help, and don't be afraid to admit that what you're doing is difficult. And be honest with yourself and know that there are resources out there that can help you through your journey. There are professionals out there, and yes, your loved one cannot be taken care of by anyone else better than you. That we get that a lot. No one can take care of my husband the way I did. Okay, they can't cook those collard greens the same way they do elsewhere, right? They can't cook the other stuff, but it's hard to let go. Like have that trust, like to have someone. Yeah, that is very difficult. However, there are people that can help you through that process. Just try it. That's what I tell people. try us out for a few sessions and see if it's helpful. If it's not, hey, we will step away, and it's okay. Okay, but having, and a lot of times at this point in their lives for seniors, they may have never talked to anybody, never been introduced to therapy. But you know, and that's scary. That's a scary thought to do, to share things that you've never shared with anyone else before. But you know, I always tell people, just try it. It works.
Wow.
It works. Yeah.
Man.
Everyone needs therapy.
Everybody needs therapy. Oh my goodness, it's so true.
I have one last question.
Yeah.
Absolutely.
Can I get back to you? Because I think like for mental health, for me, also self-care is a really big thing.
Oh, yeah.
Especially if you had a long week or
Oh, gosh,
a
yeah.
long week.
I got on the same page.
I think like you want to unwind and do something that you enjoy. So for you, how do you practice that?
Yes. Thank you for asking that. And so I have a therapist myself.
We were just talking about that.
Yes. Like, how can I promote these services and I don't even have a therapist? But when I tell you, just going to talk to her has been life-changing for me. It's helped me to rest well at night. It's helped me to be a better wife, a better mom, a better person overall. That is, I remember one day I wanted to cancel. I'm like, I'm just tired. I don't feel like it. And I'm like, I need some self-care. But I did a video, telehealth with her. She said, Tegjula, this is your self-care. I'm like, you're right. It is my self-care. Because she encourages me to take care of myself as well. Like, go get that massage, this gift card that has been collecting dust.
Right.
That I have not used yet. But, you know, I've had to realize with myself that, you know, it's okay to admit when I am going through some challenging times, but not only admitting that, but taking a step back from whatever situation it is that I'm going through and just reflecting on that. So that's what I do for my self-care. I pray, I meditate. There are apps out there that y'all can use on your phone that you can even go to YouTube for meditation, and it's crazy. They have these sleep meditations. I use them for my son too.
Oh, yeah.
And like in 15 minutes, he's out. Guess what? I'm out too. I wake up crazy like, oh, wait, it's been 40 minutes. So, but no, it just happened last week. It's amazing. It's amazing. It's amazing. So yeah, and I take walks. I do encourage people, get out the house.
Walks are huge, yeah.
Get some sun. Take a walk. You know, so just those simple things help a lot. That's what I'm doing. Oh, and I started back to the gym this week.
Nice. There you go.
Yeah,
There you go.
Well,
Is there anything you implement for like staff-wise to make sure like they're...
I don't say...
each have their own way.
Well, yes. I don't implement anything in specific or for them, because our clinicians, they have other roles as well. Some of them are in private practice. Some of them work full time. And so this is just another a role for them. But what I have learned is that one of my therapists mentioned, she was like, oh, Tegjula, let me call you back. I'm on my way into therapy. I'm like, oh, okay. So when she called me back, I thought she was seeing one of her clients. So she was actually in therapy. She was like, Tegjula, you have to realize that most therapists have therapists. Because if you think about it, they're taking in so much, you know.
I was thinking about that.
So they need to release that, right?
Yeah.
So that is one thing that I have learned, that the majority of our clinicians also have therapists as well to help them cope. Yeah. And I think that's healthy.
Yeah. 100%. So when you mention senior, what is like the age cutoff for a senior?
Yes, so for our services, you have to qualify for Medicare.
Perfect. Okay.
Yes, so our services are covered under Medicare Part B.
Okay.
So even if the client is on services with home health or hospice, we can still
That's perfect.
Have them covered, bill under Medicare Part B. Yeah.
That's awesome. Okay. So they could, even if there are disabilities with Medicare, no matter how old, even you have some patients that are 30s and 40s with Medicare disabilities, you're still able to do that?
No, they have to be on Medicare 60. Non-disability
Medicare plans.
Yes.
Okay, cool. So then that means that's good for me. I didn't know that because I didn't know that the ones that are, because we have patients who are in 40s that are on Medicare.
Right.
They wouldn't be. They wouldn't qualify.
They would not qualify.
Okay, cool.
Correct.
Okay. Wow.
So if they're pulled in, like because of that family dynamic stuff, like if it's their daughter or son, is that just covered under the parent?
Exactly. Yes.
But then
Absolutely.
once they stop with the parent and they want individual,
They have to go somewhere.
Exactly. Yes.
That's good.
Yeah.
That's good.
Yeah.
Wow.
Good question. Yeah.
Any closing thoughts as we kind of
Any closing thoughts? Again,
advice?
you've probably already heard me say everyone needs therapy at some point in life. As people pass away, as you change jobs, as you are raising kids and going through relationships, again, issues come up and you need help with navigating through those. And so that's what we're here to do for seniors, senior adults. And I'm hoping that, if everyone had at least one therapy session in their life, this world would be such a better place.
Just to talk.
Yes.
Then you're focusing on yourself and that's so true.
But it's our goal that our clients thrive on our services, that they see a change within themselves, within their overall wellness.
Yeah.
So that's why we're here.
That's cool. Thank you for what you do for seniors.
Yes.
I appreciate
you. Thank you.
Good stuff. That was good. Hope you enjoyed the video. Please remember to like and subscribe. We hope this was a blessing to you, your family, your loved ones, all your friends. Share it. And if you want to watch more videos, here they are. Enjoy, and we'll see you guys next time. Peace.